one of the owners of Holistic Therapies for Life here in Beverly, Massachusetts. The other owner, her name is Kristen Hart, and we are both holistic medical practitioners. I am an occupational therapist. Kristen is a nurse practitioner. So I was asked today to teach and educate on using yoga therapy to help with fall prevention. The poses that I'm going to be showing you today is Tadasana, which is mountain pose, Warrior 1, which is Virabhadrasana 1, and then tree pose, which is Rikshasana, and how we can use these to help prevent falls and due to any sort of disorder, Parkinson's or inner ear, vestibular issues. So first I want to just show you how I would help somebody in a yoga therapy session. So right now you see me rolling a tennis ball under the sole of my foot. And what I'm doing is providing my feet with proprioception. Proprioception is just me giving information to my muscles and joints using a tennis ball. So I can peel away the fascia so I can really feel grounded into the earth to help maintain stability in a pose called Tadasana. So what I do to one side, we must do to the other to keep the body symmetrical. And so here I am in Tadasana. But what we need to be aware of is really rooting down into the earth. As I root down into the earth, I'm lengthening my spine from my pubic bone to my navel, navel to my throat, throat to the crown of my head. I'm bringing my hands right here down by my side to have a good base of support to help with my balance. My ears are in line with my shoulders as I draw my head to the back of the room. And then I just take a slight tuck of my tailbone. The core is so important for balance. In yoga therapy, this energy center here is the first and second chakra. It's where we feel safe. And we can create a nice containment in our core called a Mula Bandha by tucking the tailbone to activate the core. So I feel super stable in this position here. If I was to advance now into another pose called Virabhadrasana 1 or Warrior 1, I would simply tell my student or client to weight shift backwards. To do that, I'm going to have to place more weight into a standing leg, which is my right leg here. And I'm going to take a look at my feet, making sure I have nice stability, feeling the three corners of my feet, which would be the big toe mound, the outer side of my pinky toe, and the heel of my foot. I'm going to draw my energy back as I extend my back leg here. And I'm going to put more pressure or stability in the back of my heel, anchoring down. My hands are on my hips to help with my balance here as I take my knee and make sure that it's in line with my second toe. I'm really working in here, creating a nice 90-degree angle in my hip flexor. So as I anchor into the back heel and I anchor into the big toe mound, I'm going to now create that Mula Bandha, that nice containment in the pelvic bowl as I tuck my tailbone. When I'm ready, I'm going to inhale, gather prana, which is energy or life force, as I draw my fingers up to the sky, and I'm going to frame the back of my body as my shoulders come away from the ears, holding the breath, or not holding the breath, but breathing in, holding the pose for 3 breaths. I will now transition back to my heart center, taking my thumb right here at my sternum, weight shifting forward, coming back into Tadasana as a transition pose. Now here I'm not going to go to the other side, but as I said, we want to keep symmetry in the body, so I would have that student or that client switch legs. But here I'm just going to show you how to come right into tree pose as I kickstand here, weighting down into my standing leg. Bring my hip into a 90-degree angle, finding a drishti, a non-moving object in front of me. As I bring the sole of my foot to my inner thigh, finding my stability, breathing, gathering prana, And I'm really strengthening my ankle, my calf, tucking the tailbone, rooting down to rise up. And here we end in this apex pose of Rikshasana. Threading my hands through, coming right back here into Tadasana. Now with somebody who does have inner ear or really cannot hold their balance because of an injury or a diagnosis, we have a chair here. So we can modify yoga by using props, adaptations. So if I need to be in Tadasana, I can stand here. If I need to use the chair to come in Warrior One, I can have the chair here. Still, same action in anchor. And if I was to come into tree pose, I can come here. As I come back down into Tadasana, I just want to thank you for watching this video, and I hope you were able to take a couple tips to help with any of your patients, clients, students, or family members that have inner ear issues that are creating any imbalances in their life, or just want to kind of flow and